Hand washing is the most important technique for preventing and controlling transmission of infection. Hand hygiene refers to the use of antiseptic hand rub or use of soap and water to perform simple hand hygiene or surgical hand asepsis. Performing hand hygiene properly and consistently is not optional. It is the critical responsibility of all the healthcare workers. Now let's review CDC recommended 5-point contact hand hygiene. CDC recommends that all the healthcare workers should wash their hands at these 5 points. Number 1, before touching a patient. Number 2, before providing a clean or aseptic procedure, for example, NG tube feeding, etc. Number 3, after direct contact with body fluid, for example, emptying patient's urinary catheter. Number 4, after touching a patient. Number 5, after touching surfaces around the patient, for example, patient's table, patient's TV or remote, etc. Now, let's review the steps of hand washing. If your hands are visibly soiled, it's always recommended to use soap and water. If your hands are not visibly soiled, then you can also use alcohol rub to wash your hands. Let's review these steps. Approach the sink. Make sure that your uniform is not touching the sink. Turn the tap on or the faucet on. Make sure you apply enough soap to cover all hand surfaces after wetting your hands. Rub hands palm to palm. Then right palm over left dorsum with interlaced fingers and vice versa. Afterwards, palm to palm with fingers interlaced. Moving forward with back of fingers to opposing palms with fingers interlocked. Then you perform rotational rubbing of left thumb clasped in right palm and vice versa. Then rotational rubbing backward and forward with clasped fingers of right hand in left palm and vice versa. Rinse hands with water and make sure you dry your hands thoroughly with a single-use towel. And you can use the towel to turn the faucet and the tap off. Now your hands are safe and clean, and you can perform procedure on the clients. Hello nurses and nursing students. Thank you for watching our video, and I hope you guys learned about hand hygiene. Now what's next? Next is to practice NCLEX-style question related to the skill, because most of the time students find it hard to transition their clinical knowledge into the questions. So let's just review the questions. Let's just do question number 1. Here is the question. The nurse is teaching a group of middle school children about the importance of infection control. Which of the following statements by one of the students indicate an understanding of proper hand washing? Now here are your 4 options. I'm going to give you a minute, pause the screen, and read those options and choose your answer. All right, option number 1. If I use really hot water, I don't need to use soap. What do you guys think about it? Is this correct? No, absolutely not, because you guys know it's very important to use the soap. So unfortunately, that's an incorrect option. Now let's just read option number 2. B statement. Washing my hands with soap and water or for at least 10 seconds will ensure they are clean. What do you guys think about this? Do you think 10 seconds are good enough for hand washing? What did you guys learn in the skills video? It's minimum 20 seconds as per CDC recommended guidelines. So option B is also incorrect. Let's just review option number C. Option number C says, I need to clean under my nails, between my fingers, and all the surfaces of my hands. What do you guys think about this? Yes, this is the correct option, because you guys know, you have watched it in the video. It's very important to clean all the surfaces, including underneath the nails and everywhere. Excellent. Option number D is incorrect, guys, because you know hand sanitizer is very effective in hand hygiene situation where there is no visible soiling of the hands. However, there is no substitute for washing your hands thoroughly with soap and water. So especially when your hands are visibly dirty. I hope you guys enjoyed learning this question. Now let's just move on to the second question related to this skill. All right, so here is your second question. The nurse is caring for a patient with cancer who has a weakened immune system because of treatments. Which of the following hand hygiene practices should the nurse follow to prevent the transmission of organisms and protect the patient? I hope you guys know about these patients. These are neutropenic precautions, right? So read these 4 options and choose your answer. Make sure you guys pause the screen. Option A, using 60% alcohol-based hand sanitizer before and after patient contact. This seems like a correct option. So let's just keep it in our pocket, okay? Let's just review option number 2. Washing hands with soap and water for at least 20 seconds before and after patient contact. Wow, that also looks like a correct option because we just learned it in the video. Now let's just review option number C. It says wearing sterile gloves for all the contact with the patient. Because you guys know sterile gloves are only for sterile procedures. That's what we use. For general contact, normal contact, we use just clean gloves. Option number D, it says, wow, both A and B. So good job, guys. The correct answer is D because it is addressing both the statements which are correct, which is A as well as B. I hope you guys are still enjoying and carrying on and learning on with these questions. All right, so question number 3. The nurse is providing patient teaching on the proper technique for hand washing. Which of the following actions should be included in the nurse's teaching? Select all that apply. Oh my God, SATA question, which students are always scared of. But guys, don't be scared of SATA questions. We will attempt those questions in a true-false strategy, and that will help you do the exam questions when you're writing your real NCLEX exam. So let's just review all those statements. And here are your statements. Give yourself a pause, and then I will review it with you in a true-false statement style. All right, so let's just review the option number A. And you guys know this is a SATA question. So we will be doing it in a true-false strategy. We'll go statement by statement. Statement number A, scrubbing hands for at least 20 seconds. And you guys know you learned it. This is absolutely correct. So put a check mark beside it. Option number B, which is 2, drying hands with air dryer or clean paper towel. Did you guys learn that in the video as well? Yes, so that is also correct. Put a check mark beside it. Option number C, rinsing hands under running water before applying soap. That is also appropriate technique. You guys have learned that too. So yes, C is also correct option. Option number D, when performing effective hand hygiene and alcohol-based hand sanitizer, scrub the palm of the hand and the underside of the fingers. What do you guys think about it? Is that the only area you clean with the hand sanitizers? No, you have learned it's a thorough hand washing following all the steps. So D is incorrect. Option number E, keep your hands lower than your elbows while scrubbing hands with soap and water. That's true. That's principle of gravity, right? So that you are not bringing back the microorganism up to your hands. So E is also correct. So in this one, in this set of questions, all the options are correct except option number D. This is how you attempt your question in the NCLEX as well. So let's just review our final question. Oh my God, the last question, SATA again? What? Oh my God, but we are going to do this question together and we're going to do it correct. So question number 4, when caring for a client who has been diagnosed with Clostridium difficile, which stands for C. diff, we commonly call it C. diff, which of the following hand hygiene practices should the nurse follow to prevent the spread of the infection? Select all that apply. So here are your statements. Make sure you guys go through it. You know the drill. Make sure you're reading it as true and false statement and choose whatever you think is the most appropriate option. So let's just review option number 1A. Wearing clean gloves for all client contacts. What do you guys think about it? This is correct. This is an acceptable PPE practice for contact with a client with C. diff. However, gloves alone are not the substitute for hand hygiene, and hand must be washed with the soap and water after removing gloves. However, we will choose this option. So in your notebooks, you can put a check mark. Let's just review option number 2, using alcohol-based hand sanitizer before and after client contact. What do you guys think about it? Unfortunately, this option is incorrect because C. diff is a difficult organism as it creates spores that are resistant to alcohol found in hand sanitizers. So this makes alcohol-based hand sanitizer ineffective in the control of spreading C. diff. So guys, that is an incorrect option. Let's just review option number C here. Washing hands with soap and water before and after client contact. What do you guys think about it? I think you all agree with me that this is a correct statement because we just learned in an option number B that alcohol-based sanitizer is not effective in C. diff. So soap and water is the best practice for it. So option number C is correct. Let's just review the last option, which is D. Wearing sterile gloves for all client contact. What do you guys think about it? No, it's incorrect because we wear sterile gloves only for sterile procedures. Normally, you would wear the clean gloves. So that is an incorrect option. So what's the answer, guys? All right, guys. So this means our correct options were A and C. So good job for doing that question correct. All right. I hope you guys enjoyed learning clinical skill as well as NCLEX-style question practice. That's what we do at FBNPC. We are always here to support the students, and make sure you contact us if you have more queries. Please like and subscribe to our channel, and if you like this video, share it with your friends. Thank you very much.